Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us once again is Margie Prop. Thank you so much, Margie. And thanks to all of you for joining us to learn about the latest local developments. My husband and I went to the movies this past Saturday night with a friend who is a surgeon here in town. And as we all masked up to head into the Grand Theater and stood in line to order our popcorn, we got to talking about what it's like right now for him to be treating patients. And he shared that normal care is still hard to get and still interrupted because of the pandemic. And without sharing identifying details, he told us about a recent case of a football player from a surrounding community who broke his arm on a Tuesday night during football practice. And we're not talking about a hairline fracture. We are talking about bones protruding out through the skin of his arm. Before COVID, my friend explained, there would have been one phone call made to arrange a surgery, and my friend would have fixed that patient upon arrival at a Lincoln hospital, taking maybe 2.5 hours tops. With COVID, and in this case, the doctor made 4 phone calls, only to find that all of the hospitals were full, and the injured football player, with bones sticking out through the skin of his arm, had to wait until the next day, over 16 hours, to get his urgently needed surgery. There was one other care option briefly considered. My friend, the Lincoln-based surgeon, could have traveled to the neighboring community to perform the operation, but if he had done so, he would have had to bring anesthesia with him because not everything necessary for that kind of surgery was available in the smaller medical facilities of that community. However, that wasn't really an option on the table because if he left town, that would have left Lincoln down one of its on-call surgeons. This is the literally painful reality that we continue to face right now in Lincoln and Lancaster County, as well as the surrounding communities that our hospitals serve, with our hospitals as burdened as they currently are. With community transmission of COVID-19 still as high as it is in Lincoln and Lancaster County and our surrounding communities, we remain in a situation where medical practitioners still have to delay care of our loved ones. Normal care is still hard to get and still interrupted because of the pandemic. The health measures that we have in place locally are designed to help change this situation. Our local health measures are in place to help limit the spread of COVID-19 and therefore help clear out the hospitals so that people in our community can get not just COVID-19 care, but normal medical care when they need it. What doctor wouldn't be concerned about a young football player with bones sticking out of his arm having to wait 16 hours to get surgery? Infection risks go up. The chance for good outcomes go down. Not only what doctor would be concerned, but what young athlete, what parent wouldn't be concerned? What individual with chest pain needing to go to the ER wouldn't be concerned right now? We all should be concerned about the disrupted and delayed care people are experiencing locally. The good news is that we all can do something about this situation. By wearing our masks, we help protect our athletes, our children, and adults who need surgeries and emergency care. We protect each other and our community. With our local measures and our collective efforts, we have brought our case counts down and freed up hospital capacity before. And we can do it again. Working together, we can make the additional progress necessary to get to the place on this pandemic curve driven by the Delta variant where no young athlete, and no one, period, has to wait overnight for the medical care they need. Health Director Pat Lopez will now give us the latest update on our local situation.
Thank you, Mayor. We have indeed made progress over the past 2 months, and we've done that together. We put in a lot of effort to get here by getting vaccinated, masking up, and using other preventative measures. I want to thank our residents, healthcare providers, and hospitals, businesses, and schools for consistently stepping up throughout the pandemic and taking action to help protect our community. However, the Delta variant continues to impact many people in Lancaster County as well as our hospital capacity, leading to a local situation that remains concerning. Let's start with taking a look at the latest data. As we've been reporting for the past few weeks, the decline in cases we experienced in September has flattened in October. This chart shows how the 7-day rolling average of new cases has leveled off at about 80 cases per day. When we look at cases over the entire pandemic, we see that this has happened before. A surge, then a decline, then a plateau, before our case numbers change and go down again. We would like to see case numbers drop to a sustained average in the range of 40 to 45 new cases a day. This plateau effect is also reflected in the positivity rate with 6 straight weeks now in the range of 9 to 10%. The positivity rate is an important indicator of the spread in our community and is still too high. We want to see a positivity rate down into 5 to 7% range to indicate that the risk of transmission in our community is reduced. Now, looking at the 7-day rolling average of COVID-19 patients hospitalized locally, it declined from 108 patients on September 21st to 89 at the end of last week, and we have consistently been under 100 patients since October 6th. But that number is still too high, and local hospital capacity remains a serious concern for our entire community. The case the mayor shared is an example of what can happen when our hospitals are extremely full. We need to continue to bring the number of COVID-19 patients down to provide some relief to our medical professionals and to make sure that those who are sick or injured can be taken care of quickly in our local community. The number of Lancaster County residents hospitalized is up today with a total of 86 COVID-19 patients. 53 of them are from Lancaster County. In addition, so far this month, we have lost 18 members of our community due to COVID-19. We have no deaths to report today. Overall, many of our local indicators used to determine risk have been holding steady over the past few weeks after showing previous improvement. For this reason, we will be staying in the elevated yellow category on the risk dial. Here you can see on the color-coded risk map the indicators spread across the different risk categories. Our local positivity rate remains high and is in the red category. The case rate, death rate, and hospital capacity remain in the orange category. Contact tracing is in the yellow category, while testing turnaround time and vaccination rate are near green. The position of the dial is shown by the blue square outlined in red, which remains on the border of orange and yellow. The data tells us our local situation is still concerning, and we're not yet in a position where we can safely remove the mask requirement. We will be extending the directed health measure through Wednesday, November 24th. And let me emphasize that we're in a better position now than we were a month ago. Our collective actions, which include wearing a mask and getting vaccinated, are moving us forward, and we need to continue to push through this surge driven by the Delta variant. We must exercise caution and not remove measures too soon, only to have our numbers reverse and undermine all the progress and hard work we've done. We understand people are getting tired. Pandemic fatigue is real and understandable, but it's important to continue to be patient and stay focused on what we need to do to further decrease the risk of COVID-19 in our community. Between now and Thanksgiving, we have the collective power to push those numbers down through vaccination and masking. We can do this because we've done it before. We are fortunate to have safe and effective vaccines that offer strong protection against severe illness, hospitalization, and death, and vaccination continues to be our best defense against the Delta variant. Today, we're hitting a milestone in our vaccination efforts with 75% of Lancaster County residents aged 16 and older fully vaccinated. Since the first shipment of COVID-19 vaccine arrived in mid-December of last year, we've seen a tremendous response from our community and our partners. Achieving this milestone gives us reassurance that we've been able to reach and help protect a significant portion of our population through vaccination. The health department's next focus will be to have 75% of all Lancaster County entire population fully vaccinated. Right now, just over 60% of our 319,000 residents are fully vaccinated. Those who are experiencing some of the most severe outcomes from COVID-19 are people who are unvaccinated. According to the Nebraska data from mid-September to mid-October, people who are unvaccinated have a 3.4 times greater risk of testing positive for COVID and are at 10.5 times greater risk for being hospitalized and at 14.5 times greater risk of dying from COVID-19 compared to other fully vaccinated individuals. We urge everyone who's eligible to get vaccinated as soon as possible to get vaccinated. Here's a breakdown of people fully vaccinated by age group. As you can see, all age groups age 45 and above have reached and exceeded 75% fully vaccinated. The percentages for the age groups 12 through 44 are rising, but there's still opportunity to increase vaccination rates in those groups. Now let's look at further breakout of our school-age children data and our young adults, age 12 through 24. As you can see from this chart, 73% of 16 and 17-year-olds are fully vaccinated, but just 47.5% of young adults ages 18 through 24 are fully vaccinated. We continue to work with local colleges, universities, and other partners to provide ongoing and convenient vaccination opportunities for this age group to get this vaccination rate up. Children ages 12 to 15 became eligible to receive vaccine in May, and you can see 61% of that age group is fully vaccinated. Vaccine approval for children 5 to 11-year-old is likely to come soon, adding about 29,000 youth to the list of those who are eligible for vaccine and aiding in our community's progress in this fight against the virus. Pfizer recently asked the FDA, Food and Drug Administration, to approve the use of COVID-19 vaccine for children in this age group. The FDA's advisory panel is meeting today. If votes to recommend Pfizer vaccine for children ages 5 through 11 are approved, then the next step would be for the FDA to authorize emergency use of vaccine in that age group. Then the advisory committee for the Centers for Disease Control and Prevention would decide whether to recommend the vaccine for children ages 5 through 11, and the CDC would make the final decision. We met with local pediatricians and other partners, and we have a plan for providing vaccine to children in this age group when it becomes available. It includes partnering with school districts to host vaccine clinics at local high schools within the city and the county and other community centers. Vaccine would also be provided at local pediatric practices. They have been currently providing COVID-19 vaccine to children aged 12 and up and have played a really important role in expanding vaccination opportunities for children in our community. We understand that some parents may still have questions about vaccinating their children. Providing COVID-19 vaccine at pediatrician's office gives patients an opportunity to have a conversation with their child's healthcare provider and ask about the vaccine and any questions they have. If approved, COVID-19 vaccine for children also is expected to be provided through some local pharmacies and federally qualified health centers. The best thing we can do for now is to protect our children till the option to get vaccine is available to them and to get vaccinated ourselves and wear a mask. Ensuring that our residents have ongoing and convenient opportunities to receive the vaccine remains a top priority. People in our community are getting vaccinated every day, and we continue to work with various partners to host clinics so you can get a vaccine close by you, a first dose, a second dose, or a booster. to really help our existing protection against COVID-19. On Thursday, the CDC approved booster doses for Moderna and Johnson & Johnson vaccines. Now there are booster dose recommendations for all 3 available COVID-19 vaccines. And I want to take a quick look at the booster recommendations. Pfizer and Moderna booster doses are currently approved for the following groups at 6 months after the second dose: the people over 65 and residents in long-term care facilities, people age 18 to 64 with underlying medical conditions that put them at risk of severe outcomes from COVID-19, people who work or live in settings where they have increased exposure to COVID-19 are also included. We're currently providing Pfizer booster doses, and we'll start providing Moderna booster doses at some of our booster dose clinics later this week. Once we receive the final guidance from CDC, which is expected soon, we will provide more details. We will also be providing booster doses to anyone who falls within the current CDC recommendations. Booster doses of the J&J vaccine are now recommended 2 or more months after the initial dose. The J&J or Johnson vaccine boosters are being offered at several local pharmacies. The CDC recommendations also allow people to choose which vaccine they receive as a booster dose. Some people may prefer to get the same type of vaccine that they originally received, and others may prefer to get a different booster of a different vaccine. As I mentioned, several local pharmacies are providing the booster doses, and many offer all 3 types of COVID-19 vaccine. So find a pharmacy near you at vaccines.gov or by texting your zip code to 438829. Our actions have been and will continue to be guided by the latest data. We continue to actively monitor our local situation, analyze the latest information, and we will make adjustments to our data-driven approach as appropriate. Once again, you can find information on the directed health measure along with frequently asked questions at covid19.lincoln.ne.gov. And residents can also track our local data via the COVID-19 dashboard. We also issue COVID-19 updates every weekday and include the latest data and information. These are all posted at covid19.lincoln.ne.gov, and you can also find the updates on the city's homepage at lincoln.ne.gov in the latest news. And if you use social media, you can follow the City of Lincoln and Lincoln-Lancaster County Health Department on Twitter and Facebook for COVID-19 information and updates. And if you have COVID-19 questions or if you're seeking general information and resources, the hotline is operational through Friday from 8 to 4:30 at 402-441-8006.
Thank you, Director Lopez. We know that the actions of individuals can impact the health of our entire community. And we know that our collective efforts can and do have a major positive influence on the direction this pandemic takes. This is the time to continue to make those collective efforts as our local hospitals are overburdened and our healthcare professionals remain under extreme stress. And with that in mind, we encourage everyone to take the opportunity to say thank you to our medical care providers as often as we can. And in that spirit, our Community Health Endowment has organized Hospital Hero Appreciation Week for the week before Thanksgiving. And it is my honor to issue a proclamation as part of this community-wide expression of gratitude. And it reads like this. Whereas the 7,000 hospital workers at Bryan Health, CHI Health St. Elizabeth, and CHI Health Nebraska Heart serve Lincoln and the region with deep commitment and a unified vision to heal the sick and to save lives. And whereas during this ongoing pandemic, these hospital heroes continue to demonstrate dedication, resilience, and courage to care for our sick loved ones affected by COVID-19 or other illnesses. And whereas, in addition to saving the lives of many area residents, hospital heroes often have supported our loved ones when family and friends were unable to be present. And whereas our hospital heroes have responded rapidly with skill and creativity to administer life-saving COVID-19 vaccines to residents and have been invaluable partners to the Lincoln-Lancaster County Health Department in our community's vaccination and pandemic response efforts. And whereas hospital heroes have worked countless hours of overtime and extra shifts, making immeasurable personal and professional sacrifices to battle the pandemic. And whereas the families of hospital heroes also have earned our deep gratitude for their support of our healthcare professionals and for their sacrifice of family time for the greater good. And whereas we have been inspired by the courage and the compassion and sacrifice of our hospital heroes as their bright light of dedication has shone even in our darkest hours. Now therefore I, Lyrian Gaylord Baird, Mayor of Lincoln, Nebraska, do hereby proclaim November 15th through 19th, 2021 as Hospital Hero Appreciation Week to thank the hospital heroes of Lincoln for their heroic efforts during the pandemic. And I call on all residents to acknowledge them for their devotion to the health and well-being of our community. Let's get this signed. Joining us today to receive the proclamation and with more details on how we can all participate in Hospital Hero Appreciation Week is Kim Moore, Chair of the Community Health Endowment Board.
Thank you, Mayor. Thank you. We are so excited about this. We're excited to share this proclamation with our hospital workers. You know, as life outside of Lincoln slowly has settled into a pandemic normal, the challenges inside the hospital walls as a result of the COVID pandemic remain difficult and constant. We cannot go inside those walls and help care for patients, but as the mayor said, we can support them by wearing masks, getting vaccinated, and saying thank you. What better time to offer thanks than during this season of Thanksgiving? We are giving our residents an opportunity to participate in Hospital Hero Appreciation Week with a citywide thank you card campaign. The Community Health Endowment will provide free special thank you postcards for your note of gratitude to hospital workers. There are two ways to get and send thank you postcards. One is to stop by any of the mill locations or the Hub Cafe between October 26th and November 9th. Postcards are available at each of these sites. The addresses for those businesses are on your screen. Simply pick up your postcard, write your personal note of thanks, and drop it in the drop boxes at these locations. If you would like to involve a group, an organization, a business in these card campaigns, contact the Community Health Endowment at 402-436-5516 or at the email on the screen. We will provide cards to you in bulk for you to return to us by November 10th. Our goal is to collect 5,000 thank you cards and flood our hospitals with gratitude. Let us all experience the health benefits that gratitude brings us by remembering our hospital workers as they continue to devote themselves to their demanding work.
One of the advantages that Lincoln has had throughout the pandemic is the close working relationship between our public health professionals and our hospitals. And joining us again today are Derek Vance, the president of CHI Health, St. Elizabeth and Nebraska Heart, and Russ Grunewald, president and CEO of Bryan Health. And we're so happy to have you both here. And thank you so much, Kim.
Thank you, Mayor. We're very excited about this. Thank you.
Thank you.
Thank you, Mayor and Kim, for that excellent proclamation. It means a lot to me and to our staff, and we'll look forward to celebrating that and feeling of that support and recognition in a few weeks in November. I'll give a couple of brief updates around our hospitals, kind of where we are and where our staff is, and I'll keep my remarks brief this afternoon. In short, our hospitals are beyond busy, as you've been hearing for many weeks now. Our emergency department, our surgical services, trauma department, inpatient acute areas are all full, and they've been full for many months. And while COVID is definitely part of the story, it is at this point a smaller part of the story. In fact, recently we have seen right around 10% of the patients that come through our emergency department presenting with COVID or COVID-like symptoms. That number has been as high as 40%. So that is down significantly, which is we're grateful to see. We, of course, are entering our normal cold, flu, RSV season. Our pediatric ER is seeing record numbers of patients, as well as our labor and delivery unit, our neonatal intensive care unit, seeing volumes that it hasn't seen in years. So COVID is part of the story, but it is at this point a small part of the story of what's hitting our hospitals. And we're grateful to be in a position to take care of so many members of our community and surrounding area. That said, our greatest challenge and my greatest concern right now is our staff. So this recognition is especially appreciated. The surge that we have been feeling at CHI Health has been with us now since the beginning of summer. Our staff continue to show up every day, positive for the most part, committed, delivering personal, excellent patient care, but they are beyond exhausted. I've said those words a year ago, and that has not changed. Our staff remain consistent and committed, but they are tired. Along with most every hospital in the country right now, we cannot find enough staff to support the level of sustained surge that we're experiencing. We would typically supplement our hospitals with traveling or agency staff, and there's simply not those staff to be found right now. So my plea to our community is to stay healthy, to stay well. And when you need to seek health care, please seek it appropriately. Please use our emergency rooms for emergencies. We are very fortunate in Lincoln to have excellent primary care and urgent care available to us. Our priority care centers are open 7 days a week, 8 a.m. to 8 p.m. for those basic needs. That primary care and urgent care in our community is there, and it's excellent. And by utilizing that appropriately, that helps us deal with the surge that we're experiencing in the hospitals. Right now, we really need our hospital resources to be focused on acute care hospital needs. Lastly, I would just say I am so grateful to be part of the Lincoln community. We have received so much support in the last 18 months to 2 years during this time of challenge. Support in the form of supplies, food, letters, hugs, phone calls, so many different ways, which means so much to our staff and to me. Another way of course, that you have supported us as your local hospitals is through following of our mask mandates and being socially distant when around others. This makes a tremendous difference, and we know that it works. So keeping our community healthy and well needs to remain our top priority right now. Thank you for your continued support of our hospitals and for continuing to follow the guidance of Director Lopez and her team. I'll turn it over to Russ.
Thank you, Mayor. Thank you, Director Lopez, for the partnership that we have. I know that that's a word that we also use a lot, partnership, over the years. And I wouldn't say it if we didn't mean it. I was just thinking last week I was frustrated with something, and I just decided to hit Pat Lopez's number. Yes, I have Pat Lopez's number. And I said, Pat, I'm just so frustrated. We have to do something about it. And essentially she said, I'm way ahead of you, don't worry about it. And she was way ahead of me. She didn't say it quite like that. She calmed me down first. But that's what a partner is, that we know what the needs are of each other, and we anticipate those when we work together. And that's just gone on from the beginning of the pandemic. Thank you, Kim Moore, for the work you guys are doing at CHE, as well as for the proclamation, Mayor. That, again, as Derek said, means so much to our staff. I just really want to also thank the city of Lincoln. Just every time we've needed you, you've steadfastly been there. And there may be a detractor here or there, but I would just say the large bulk of the city just continues to support us in so many ways. They express concern, they express thanks, and it's really important into the health of our own folks as they just, they go slug through this every day. They know and they feel your support, and it's important to us, so thank you. Where are we at Bryan? Similar status, overflowing. We had about 560 patients this morning at midnight. We had 560 patients. We are full at 5:40. That means we had folks waiting for rooms in the emergency department. Yesterday, we had 16 folks on a waiting list from Greater Nebraska. These were not COVID patients. These were patients like the one that the mayor described earlier, very much in those categories, needing to get to a higher level of care and unable to do so because we were full here in town. So 60 patients, roughly, 60 COVID patients, between 50 and 75 at any given point in time. All of those could have been taken care of. The ones that are waiting in Greater Nebraska, the ones in our emergency room waiting for beds, all of those could be taken care of if we weren't still fighting the COVID fight, which of course we need to do right now. It's the most important thing. But nevertheless, that's why we need to continue to bring these numbers down. We're very concerned with winter coming upon us. For all of the reasons that you can guess and you've heard, we're certainly trying to look ahead to see what might be next there. We're being very careful to open up to non-urgent surgeries. That ban on certain surgeries was lifted by the governor recently, and yet we can't open our way up because we have to have those beds right now. We're just being very careful to bring a few of those surgeries that have gone from non-urgent to essentially urgent and need to be done. We'll continue to try and open those up as much as possible. We know there are a lot of folks that are looking to get work done before the end of the year, and I know that both CHI, St. Elizabeth, and Bryan would like to accommodate those if we are able to do so. Again, another reason why we need to create some capacity, and we only do that by staying well, as Derek said before. So again, just Bryan's support for the continued mask mandate at this time. We all wish we could be done with it. When I go outside later, I'll rip my mask off as fast as I can because I don't like them either, but we wear them all day in the hospital and it works. So really three things, and I had to geek out with a little numbers this weekend because every once in a while I just need to do that. And for three reasons, I would say we're really supportive. Number one, the numbers aren't down, and you saw it a little bit ago as those numbers were presented. The numbers aren't down where they need to be. They're down a little, 10% maybe from where they were at the high in the state not that long ago, but that's not anywhere close to where we used to be. At Bryan, again, or I should say in Lancaster County, I was looking over the weekend, 75 give or take, over our folks in the hospital from Lancaster County. That's a long ways from the 5 that we had early summer. So I don't know where we need to get to, but 75 isn't it. We need to be much further down than that. Daily case rates, 30 per 100,000. Well, that's a pretty good number, but it's not anywhere close to where we need to be. It's nowhere close to being out of a surge. So we still have a long ways to go. The second reason we're supportive is masks and vaccines work. From our vantage point, Lincoln has been taken one of the most consistent approaches over the whole pandemic about trying to be appropriate with the different interventions of masks, vaccines, social distancing, and so forth. And it's worked. If you look at the cumulative fatality rates, because it's case rates and fatality rates, we're much lower than almost anywhere else. I hear all the time people say, well, what about Florida? What about Texas? What about North and South Dakota and Wyoming? Yeah, what about them? I mean, their death rates are 2.5 to 3.5 times higher than Nebraska's. And even within Nebraska, we are lower than other places that have done a good job. Omaha's done a great job. We're 20% lower than Omaha. So the things that we've done consistently have resulted in more people living and not having the bad outcomes that we're talking about in this pandemic. And then finally, we support it because we don't think that masks are an impingement on freedom. We think it provides freedom for us to live our daily lives. That's the way we've approached it. That's the way we've been able to continue to do things like go to a movie or go to other events. It's because we have masks, and that's made a bunch of the difference. So we very much support this continued direction.
Thank you so much, Russ and Derek, for your leadership and everything that you and your teams are doing in our hospitals. We appreciate you so much. Before we go to questions, I'm going to ask Director Lopez to come up. We've had some breaking news occur during the briefing, and she's going to just share a little bit about that with you all.
Thank you, Mayor. During the briefing, I told my team before I came today, I said, I bet there'll be an announcement right when we're in the middle of the briefing, and sure enough, there is. And it's a great announcement. The FDA has voted overwhelmingly to recommend the Pfizer Bionics coronavirus vaccine for those age 5 to 11 years old. So that is really great news. We couldn't ask for anything better. Now we just need to get it moved through the rest of the process, and we'll be ready to start moving in Lancaster County.
That is great news. With that, we'd be happy to take any questions, and knowing what week it is, I'm just going to lead off with an answer that Halloween is on. Thank you. Any other questions?
From Dale Johnson at KFOR, and this is one for Pat. If a person is fully vaccinated and then comes down with a breakthrough infection of COVID-19, how long should they wait after they recover before getting a booster shot? Or is the booster shot still advisable?
That's a great question, Dale. And after they've recovered, as long as they're symptom-free, they can get a booster shot at any time. You know, originally there were recommendations to wait a certain period of time after you'd had COVID before you were vaccinated, and that's no longer true. So they can get a vaccine at any point as long as they're fully recovered. Any other questions today?
Mayor, there may be some more technical questions, so would you ask reporters just to email me if they have further questions?
Sure, I think we're having some technical difficulties, and so if there are folks from the media who do have questions, please email Diane Gonzalez, dgonzalez@lincoln.ne.gov with those questions. We'll get them answered as quickly as possible. Thank you to all our guests. Thank you to all of you for joining this briefing. Thank you to everyone in our community for doing your part to keep one another safe. And don't forget to pick up your free thank you cards at the Mill or the Hub Cafe to express your gratitude to our hospital heroes. Thank you. Thanks, Mark.